Good afternoon and welcome to this virtual meeting of the Scottish Parliament and to Portfolio Question. The first portfolio is Health and Sport. Can I remind members that if a member wishes to request a supplementary question, they should indicate in the chat function by entering the letter R during the relevant question. We will start on this occasion with question 2 and we will come back to question 1 in a moment. Question 2 is Miles Briggs.
Thank you, Deputy Presiding Officer. To ask the Scottish Government what action it will take to minimise waiting times, delayed operations.
Cabinet Secretary Jeane Freeman.
In line with our recently published framework for remobilising our health services, Remobilise, Recover and Redesign, health boards are following national and clinical advice to safely and gradually prioritise the resumption of some pause services, whilst also retaining sufficient capacity to respond to COVID-19. This work will be supported by specific recently agreed actions, including an extension of the use of the independent sector capacity to support health boards by ensuring we have COVID-free sites for urgent and cancer patients to be treated. NHS Golden Jubilee will resume key services, including in orthopaedics, ophthalmology and cardiology from the 1st of July. And this includes continued support for vital and complex cancer services. We have published a surgical recovery framework to support health boards provide cancer services through the next stages of COVID-19, assisting boards in planning where new health, safety and social distancing measures have been put in place. And we are developing further pathways for the NHS Louisa Jordan so that patients who have not been seen will wait less time. This includes patients waiting for diagnostics testing and orthopaedics procedure. But it is important to remember that we are still dealing with coronavirus. It hasn't gone away, and restarting pause services has to be measured against the need to keep the virus under control and the NHS ready to deal with cases.
Miles Briggs.
Can I thank the Cabinet Secretary for that answer? Can I ask what plans ministers have to invite back newly retired surgeons and anaesthetists to be part of that additional capacity? And also in light of what she said about the Louisa Jordan, this week it was said that the Nightingale hospitals will remain on standby. I take it that will be the case in Scotland, and there's no plans being drawn up to decommission that hospital in Glasgow at this point.
Jeane Freeman.
So just on the last point, no, there are no plans to decommission the NHS Louisa Jordan. The member will remember that it has a capacity, if needed, of 1,000 beds, with an initial plan that 300 of those beds would be needed if for COVID-19. So the NHS Louisa Jordan will remain ready to deal with COVID-19 patients if that is necessary. But in the interim, given the current readiness of our other NHS estate, the current prevalence of the virus in the community, then we are developing proposals to use the NHS Louisa Jordan, as I said in my answer. In terms of retired doctors of various types, again, the member will know that we had a significant response to our call at the outset of the pandemic for returning retired and those who have taken career breaks or sabbaticals, nurses, doctors and other clinical professions, as well as social care workers. We still have those numbers on our books, if you like. We have gone back to check with all of them if they are willing to stay available where we have not already deployed them, so that we know that we have those additional resources on hand should we need to use them.
Thank you very much. We'll now return to question 1 with thanks to Rona Mackay for her patience. Rona Mackay.
Thank you, Presiding Officer. To ask the Scottish Government when chronic pain patients will be able to resume treatment that has been suspended because of the COVID-19 lockdown.
Minister Joe Fitzpatrick.
Thank you, and apologies for losing connection earlier. Thank the member for the question. Coronavirus has had an unprecedented impact across all of our public services. We know that this is a really worrying time and we're aware of the difficulties and challenges this has caused for people living with chronic pain. That's why we're looking to re-establish these services in the next phase. We've announced that we're moving to phase 2 and the route map out of lockdown. Health boards have been planning for this remobilisation of services in line with the Remobilise, Recover and Redesign framework we published on the 31st of May, and we've outlined that this should start with the expansion of non-cancer urgent patients and outpatient services. Excuse me. It will mean that the gradual reintroduction of some chronic disease management from the 6th of July that could include pain services, and how different specialities categorise and prioritise the urgency of cases will be informed by guidance from professional bodies and, of course, local circumstances. We've also published a patient information leaflet about coronavirus for people living with chronic pain, which includes a list of available services, and that can be accessed from the Scottish Government's website.
Rona Mackay.
Thank the Minister for that answer. At a recent meeting of the Chronic Pain Cross-Party Group, patients told of their suffering during lockdown as a result of the lack of access to pain clinics. Some patients were forced to travel south of the border and pay privately for treatment. They also said that even before lockdown, access to clinics and treatment was something of a postcode lottery. Can the Cabinet Secretary confirm if the wider issues surrounding chronic pain treatment will be looked at as we come out of lockdown, particularly in regard to patient representation on the National Advisory Committee and the implementation of a national framework to address long-standing issues?
Minister Joe Fitzpatrick.
Aware that some people have made that decision to travel to England for private healthcare. During lockdown, the NHS was on an emergency footing, and it remains so in phase 2. Emergency and urgent care has and is being provided, including treatment for pain as a result of emergency acute presentations, infusion pumps for palliative care, and treatment for complex regional pain syndrome. Health boards have triaged cases locally based on clinical need, with health boards and stakeholders looking to explore a national consensus on the approach going forward to further widen that capacity as we move into the second stage. The present National Advisory Committee is paused while members focus on responding to the current public health emergency to ensure frontline services, including third sector organisations, can concentrate on providing care support to people in Scotland. I absolutely understand how challenging this is for that group, but I guess the assurance that I and my colleagues in government can make is that we absolutely understand the concerns and will work with our health boards to make sure that this is treated as a priority, but it has to be done in a way that is safe and in line with the recommendations, clinical advice going forward.
Supplementary question from Brian Whittle.
Minister, NHS boards have been reporting that even after lockdown ends, they'll only be able to work at approximately 50% capacity, obviously for the increased safety measures they're going to have to put in place. So I wonder if the Minister can give us an indication how the Scottish Government are going to deal with the waiting list or the increasing waiting lists for those suffering with chronic pain.
Joe Fitzpatrick.
Obviously, any wait when you're suffering from chronic pain must be intolerable. Throughout coronavirus, we've looked at a number of methods to try and provide people with support, the near-knee clinics, and just an example of that. So we need to look at what we've learned through the phase 1 of coronavirus to see how we can continue to support people better and perhaps in slightly different ways. But it always has to be based on clinical guidance and obviously what is safe going forward.
And a further supplementary question from Monica Lennon.
Thank you, Presiding Officer. Minister Rona Mackay raised the issue of patients travelling south of the border to access treatment. Will the Government consider reimbursing those individuals? And on the issue of a postcode lottery that existed before COVID-19, is the Minister aware that in some health boards, for example Grampian, patients can access certain treatments, infusion treatments? Does he believe that this is fair, and what will he do to end this postcode lottery and promote health equality across Scotland for chronic pain patients?
Minister Joe Fitzpatrick.
Sorry, I think it's really important that people get the clinical support that they need, and that needs to be worked out personally between them and their clinicians. Clearly, in some cases, we do support people to go elsewhere in the UK or within Scotland to get treatment. But if someone's making a personal decision to seek private treatment without liaising with their health board, then I'm not sure that's particularly easy for us to support. What I would really encourage folk who need support urgently to contact their clinician and see how that can be provided by the NHS. That would be my advice to anyone on that basis.
Thank you very much. Question number 3, Rhoda Grant.
To ask the Scottish Government who decides what categories of people are shielded from COVID-19 and what level of support they are entitled to.
Cabinet Secretary Jeane Freeman.
The Chief Medical Officers of the UK's 4 nations agreed at the outset the categories of those people who were at the highest clinical risk and should shield. In addition, clinicians can identify patients who they think are at the highest clinical risk but do not fall into the group of conditions identified by the Chief Medical Officers and add those patients to the list. The Scottish Government has worked with local authorities and key partners to provide a comprehensive package of support, which includes an SMS system and local phone lines to access free deliveries of food and household items which are delivered to individuals' houses, as well as priority delivery slots from supermarkets and the delivery of medication.
Rhoda Grant.
A constituent has told me that he has been contacted by the council 2 weeks ago offering assistance while he was shielding. He has a health condition and has had that for many years. But this was the first official notification he received that he should be shielding some 3 months into lockdown. I contacted the council and they tell me they receive updated lists of shielding persons every week, which I can understand because people's health conditions change. However, my constituent's health had not changed and he should have been on the first list. Luckily, he has coped, but many others in this situation without support might be without the support of friends and family. What's the Scottish Government doing to ensure that vulnerable people receive the help that they desperately need in this situation?
Jeane Freeman.
Well, in terms of the latter part of Ms Grant's question, I think I've outlined that. I should have said too, of course, that there is additional mental health and wellbeing support that is supported nationally by the government, but also complemented by what is available in each local area. In the particular case that Ms Grant is telling me about there, obviously I don't know the details of that, but as always, if she wishes to pass those to me, then I'm very happy to look into that particular individual's case.
Thank you very much. Supplementary question from Willie Rennie.
Health Secretary, I'm interested in advice for the over 70s. Many of them have been shielding unnecessarily for several months, and I think we need some clarity for them as the advice for those shielding and others is changing. So when can we expect new guidance to be published for the over 70s?
Cabinet Secretary.
I'm very grateful to Mr Rennie for asking me that question because it is an area I am very conscious of. It's close to home as well as being conscious of it as the Health Secretary, and he is right that a number of people over 70 have in effect shielded themselves and equally others have not. But it is important that our guidance going forward is very clear. As he will know, we have made a commitment to all of those in the shielding category that we will work through July to ensure that we can offer more bespoke advice and guidance and undoubtedly support to different clinical groups. And so our clinical advisors are working on that now. As we do that, we will then produce the right clarification of guidance for those who are over 70 or indeed in the category who currently qualify for the flu vaccine, to ensure that where they are not in one of the clinical groups that is in the shielding group, then it is very clear to them what risk they face and therefore what steps we are advising them to take. This is important to ensure that only those who are at the most extreme risk clinically from contacting this virus are asked to take what are very stringent measures in terms of shielding.
Thank you very much. Question number 4, David Stewart.
Thank you, Presiding Officer. To ask the Scottish Government how the lessons learned from the COVID-19 outbreak will help inform future outbreaks of the virus or other pandemics.
Cabinet Secretary Jean Freeman.
So although we are still responding to the current pandemic, lessons are being learned and captured as we go. For example, on the supply and distribution of PPE across health and social care. A lessons learned process for regional resilience partnerships and their member organisations has already commenced in order to capture key issues, share good practice and ultimately shape future planning and preparations. And as Mr Stewart knows, we've also received very helpful feedback from stakeholders for the Health and Sport Committee's recent session on resilience and emergency preparedness, and we'll consider that fully. All of these lessons are also being factored into the planning that we have underway in case we see a resurgence in the number of cases for the current pandemic, as well as, of course, they will be factored into any future pandemic planning that is undertaken alongside a larger review of how we have responded to and dealt with the current pandemic.
David Stewart.
Presiding Officer, the Cabinet Secretary will not need predictive powers of the Grand Seer to know that Scotland will face future. Can the critical restructuring to cope better in the future with serious health disasters by creating a centre for disease control and prevent early exit testing across a broad spectrum, to work with our universities to focus on vaccine development, and finally to create industrial level strategic PPE reserves?
Cabinet Secretary.
So my apologies to Mr Stewart, I didn't hear all of his question, but what I will say, I hope in a helpful response, and if I've missed any part, of course, I'll respond to him in writing as soon as I've had his question in detail. I think one of the things that has come out of where we are in the current pandemic that is very positive is the degree to which we have seen cooperation between national and local government, with our third sector, and importantly with our academic partners. I would want to take all the steps necessary to ensure that that continues. We have begun to see industrial level domestic production of PPE, with thanks to the efforts of my colleague Mr McKee, and I know that he continues to look for other opportunities where we can have a more resilient PPE supply chain, and has applied his mind and his skill to our testing supply chain as well. And we are, of course, linked directly to the European Centre for Disease Control. So in that regard, I'm not certain myself that we would need our own one, rather better to be able to continue to cooperate with the European Centre. And I very much hope, notwithstanding being removed from the European Union against the wishes of the Scottish people, we will still be able to do that.
Thank you very much. Can I ask for succinct supplementaries and answers, please, and to try to get more members in. Question number 5, Liam MacArthur.
Thank you, Deputy Presiding Officer. To ask the Scottish Government what its position is on having a localised approach to COVID-19 testing and tracing.
Cabinet Secretary Jean Freeman.
So to an extent, we already do have a localised approach, in as much as our test and protect system is based on ensuring that we have, is built on local health protection teams, and is then supplemented by the nationally coordinated contact tracing capacity, which enhances that local expertise and is able to flex across the country to ensure that local health protection teams can be increased where that is needed. The National Contact Tracing Centre allows that flexibility, but we will of course continue to monitor and evaluate these arrangements as we proceed with the implementation of Test and Protect.
Liam MacArthur.
Can I thank the Cabinet Secretary for that response? You'll be aware that time is generally of the essence in confirming test results and getting in touch with those who may have been in contact with somebody who tests positive. In that sense, does she agree that as far as possible, testing and tracing should be carried out at a local level, and will she therefore ensure that places such as Orkney have the equipment and capacity they need to allow this to happen wherever possible?
Jean Freeman.
So I absolutely agree with Mr MacArthur. One of the key elements of Test and Protect, any contact tracing, testing and contact tracing programme, has to be a continuous drive to reduce the turnaround time, both in the taking of the sample and in processing it through the labs and getting the results back, so that you know whether or not you now need to be moving in terms of the contacts. So if there is more that we need to do for our island communities, then we will most definitely look at that. And if Mr MacArthur has anything in particular he wants to suggest, I'm very happy to hear it. We have commissioned some early work in anticipation of the opening up of tourism to make sure that we have adequate resilience around all the key tourist areas of Scotland. We're fortunate that such a beautiful country has so many of them, but making sure that locally we have the resilience that we need should we see a spike in cases in any of those areas.
The next question is Alison Johnson.
You, Presiding Officer, to ask the Scottish Government what proportion of Black, Asian, minority, ethnic, health and social care workers have been risk assessed for COVID-19.
Minister Joe Fitzpatrick.
Thank you. Well, risk assessments are carried out independently by health and social care employers and occupational health services. Interim national guidance for Black, Asian, minority, ethnic, health and social care staff specifies that individual assessments and practical support should be offered to all BAME staff. We'll be updating this guidance following engagement with BAME staff to ensure it is culturally competent, and we'll also be asking them how they were supported during the pandemic and ask employers to take urgent action if concerns are raised. And there are 5 strands of work underway to respond to the issue of COVID-19 impact on BAME communities, which I won't rehearse.
Alison Johnson.
Thank you. I welcome the Minister's response. The BMA, however, has been warning that doctors across the UK have not been risk assessed. A poll of almost 8,000 doctors, 7,500 doctors working in the UK found that 36% were unaware of any risk assessment in their place of work, and just 11% said they had been personally risk assessed. So what action can the Minister take to ensure that health boards and care providers are conducting proper risk assessments for Black, Asian and minority ethnic staff?
Joe Fitzpatrick.
That's why it's really important. Of the 5 strands of work that we have, one of them is absolutely about engaging with the BAME community to understand their experience. We're also looking at how we can get better data in the workplace, but I think listening directly and speaking directly to BAME staff is a really important part of making sure that we not only get the guidance right in terms of its language, but we also make sure that it is applied appropriately across Scotland.
Thank you very much. My apologies to Bill Kidd. I fear that takes us to the end of this portfolio question session, and I will now suspend Parliament before we move on to the next bit. Thank you very much.